You're listening to Dr. Doris Day on Doctor Radio, Sirius 114 and XM 119.
Welcome back to Dr. Radio. I'm your host, Dr. Doris Day. I'm Clinical Assistant Professor of Dermatology here at the NYU Langone Medical Center. And for this hour, we're going to switch gears a little bit. I have as my guest, Dr. Monica Halem, who is a dermatologic surgeon practicing in New York City at the Columbia Doctors East Side. Dr. Halem is associated with New York Presbyterian Hospital. Thanks for coming in this evening.
Thanks for having me.
I'll give out our number. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. Our focus is really going to be this evening on hair loss and restoration, focusing on hair loss in women, but we are happy to take your calls. If you have other questions about skin, hair, and nails that you really want to call and ask us about, we'll take that as well. And I have to say, Dr. Halem, she looks so beautiful. You can't see her, so I'll describe. Beautiful and way too pretty for radio right now. So, so it's a pity that they can't see you. So thanks for being here. And do you see a lot of hair loss in women in your practice?
I do. I think actually hair loss in women is one of the most common things that people often don't think about. And we see it often in women. People think hair loss, they think men, but women are just as susceptible to hair loss as men are.
And the problem is in women, it starts earlier. So if a man starts noticing it in his 40s or 50s, in women, it really starts to be noticeable in their 30s.
Right. You can see it earlier on. And the pattern's a little bit different. So sometimes it's hard to tell.
What's the difference in the pattern between men and women for hair loss?
Men tend to lose hair, it starts around their temples and then progresses onto the back or vertex of the scalp. Women tend to lose hair more. They keep their frontal hairline and they lose hair more in the crown of the hair. But there's also diffuse hair loss as well as certain spots. But
so what are the most common types of hair loss? Let's focus on women. So we're talking about this can happen to men or women, but what are the most common types of hair loss? I mean, I put it into two categories, scarring and non-scarring.
Right.
But let's really look at the non-scarring types first. So what kinds of hair loss
Probably
do you see?
The most common is what we call female pattern hair loss. And again, that's where they keep you keep the frontal part of the hairline, but you often lose it in the crown of the hair. And that's the most common. The other one that's very common is something called telogen effluvium, and that's sort of a diffuse pattern hair loss, and that can be caused by several different things, including medications, strict diets, surgery, trauma,
childbirth,
postpartum,
marriage, death, divorce,
anything that causes stress,
even hormonal fluctuations. What I like about the telogen effluvium is that we put it into the hair loss category, but I tell my patients it's actually really good news because it's not a true hair loss. It's a hair shedding. It's a stress hair shedding. And typically that hair will come back. So that occurs about 3 to 4 months after the stress. And patients will come in and they'll say, but I'm not stressed. I'll say, well, what happened 3 or 4 months ago? And inevitably there's something that happened 3 or 4 months before. And so there is some relief. And the other thing is that with the telogen effluvium, when you start that shedding, you notice hair everywhere. Like the hair, you've had people coming in, they say, but my hair's just coming out, it's coming out, and there's a panic because you can lose up to 40%. So what is it about the hair cycles, and why is it called a telogen effluvium?
Well, it's called telogen effluvium because it's actually the telogen hair that's getting shed. And there's different types of patterns in your hair cycle. There's anagen, which is your growth phase.
And how long does that last?
That usually lasts about 3 to 6 months. And then you have 3 to 6 years. And then you have the catagen phase, which is, a quiet phase. And then you have the telogen phase, which is, again, the shedding phase. And this can last several months, which is why it takes 3 to 4 months, sometimes even up to 6 months after the stress is released or gone to finally catch up to the hair cycle.
And the good news is that really about 85% or so of your hair is in that growing phase at any given time in a random way. Right. And the other 15% is that resting or falling out phase. But what happens is that when you go through a stress, all of a sudden, in a very synchronized way, the hair will shift from the growing phase to that resting and shedding phase, and up to 40% of your hair, all of it together, can shift over. Now, listen, if 100% of our hair was synchronized, it would grow for 3 to 6 years, and then it would rest, and then we go bald every so many years. So clearly that doesn't happen. But women do come in. I've had women come in, and they say, you know, my hair has been falling out for 10 years. I've been losing my hair like crazy for 10 years. Well, some of that hair has to be coming back. You can't lose that much hair over so many years and still have any hair left. So the hair is growing back, but we don't notice the hair growing back.
Right.
We only notice what's falling out.
And it's normal to lose about 150 to 200 hairs a day. So, you know, if that's expected. You know, when we
read
wash
about
our hair,
how we measure
brush
that.
our hair,
Yeah.
it's to be expected. So a lot of people come in and they say, but I'm losing hair. Well, there is a certain amount of normal hair to be lost.
Right, but once someone's turned on to the hair falling out, then all of a sudden any hair that comes out seems like too much,
Right.
and they come in with pouches of hair.
Right.
But the thing is that 150 to 200 hairs a day, I was doing some research for something I was doing on, like, where does this number, how do you measure that 100 hairs a day? So the idea is that you don't shampoo or wash your hair. You know, you do it the night before. Then the whole next day, don't do anything. Don't shampoo, don't wash, don't brush, don't do anything. And then in the evening, like ideally before bed, you'll brush for 3 minutes with, you know, not too harsh a brush, but you just brush for 3 minutes, and the hairs that you collect, the studies show that that's what you count, and that's what you get as your 150 to 200 hairs. And you know, hair does change. Hair will change over your lifetime. When you're little, it might be finer, and then it becomes thicker, curlier sometimes. The texture, the density, the volume changes, and then when you hit your 30s, it can change again, and then around menopause, again, it can change. So there is a natural transition, not just of hair color, but hair texture,
Right.
density, volume of each hair and the overall numbers of hairs. So the ponytail might seem smaller. It doesn't mean you have less hair necessarily. May mean that the hair has just changed.
Right.
But it is so disconcerting. So what do you tell people that they can do about the hair loss?
Well, the most important thing is that every patient needs to be individualized. So there's many different causes of hair loss, and you know, it's important that patients, I often tell my patients, we need to do a workup on you. We need to see exactly what the cause is.
So what do you do for the workup?
Well, we do anything from, we look at the medications patients are taking. Again, we ask about any trauma or stress, because that's very important. And we also look at some blood work and see, is there other associated problems? Thyroid can be a problem. Iron capacity could be a problem. So, as well as hormonal changes. So it's important that we look at these factors and see what's going on, and that way we can tailor the treatment for it.
See, my problem with the thyroid is that I have women coming in and they may have a thyroid issue, but they think that if they fix the thyroid, the hair will grow back. Right. And so I try to explain that it's really two different things. That if your thyroid is underactive, that your hair may be drier, more brittle, and thyroid fluctuations may contribute to a stress shedding.
Right.
But if your thyroid is underactive, addressing that doesn't make the hair grow back. Right. So, and then if you have an overactive thyroid, that may make your hair cycle more quickly, but it's also causing that stress type of a pattern more than the hair loss. Right. Because I have people just focusing, and they think, well, if I fix this, then that will get better. And it doesn't, unfortunately. So, so I try to keep the thyroid out of it a little bit at least. What do you think of the keratin treatments?
You know, I don't know as far as whether they cause hair loss.
Yeah.
But I would say that a lot of those treatments do damage the cuticle of the hair and do damage the hair.
You think so? Oh.
I think so. But, you know, I haven't seen patients come in that have had these done complaining of hair loss.
Yeah.
But
I think if you overtreat in terms of coloring and highlighting, that might be an issue. But I don't know. My observation has been, and it's not, I mean, look, you have two people here who do a lot with hair loss, both dermatologists who specialize in this, right? And my observation has been, because I haven't done a clinical trial on it, and I think it'll be interesting to see what it does, but is that in patients who have dry hair that's brittle and breaks easier, and not overcoloring, not highlighting, not bleaching the
whether
hair.
that actually helps
or
not.
Is that I have found that the hair seems to be stronger and seem fuller, that if it's done well, it can actually give some volume to the hair. But I do think that if it's over-processed, it can cause hair breakage. So it does matter what other products you use, what other treatments you've done, and how much you do it.
Right.
But I think it can be beneficial when done carefully by someone who's using the right formula and paying attention.
And that's the key. It's really, a matter of somebody doing it the correct way.
Okay. I'll give out our number. We'll take a call. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. And we have Jay in Michigan. Hi, Jay.
Hi.
How are you? Thanks for your call.
I'm good. Thank you. I love listening to your show.
Thank you.
I have a daughter who is 20, and for the last 3 years at least, I have noticed that her hair is getting really thin. I mean, very thin. So she's concerned about it, and I'm concerned about it. And I was just telling her that I thought maybe her birth control pills might have something to do with it. She's been on them since she was 16. She wanted to go on them because all her friends were going on to help their skin clear up, and her skin does look great. I don't know. I thought maybe that medication at such a young age could have been a factor. And then just recently, she got some blood work done, and it showed that her testosterone level was at 78, and I didn't know what that meant. It was on the high side, the information said.
Yeah,
so I would like to.
That's kind of exciting. So I'll give my opinion, but I want to ask your opinion, Dr. Halem, about this. So this is somebody that I would put on a medicine called aldactone in a second. You agree? Oh, good. So I think the pill is probably helping her, but she has, it's what I was talking about. Like in women, it starts in their 20s much more than it does in men, and it's very significant. So someone at this age, as long as they're not planning pregnancy, there's a medicine that's a hormonal blocker, blocks the androgen receptors that are contributing to that testosterone problem, which may be a problem for her. That medicine might really help her not just stop losing hair, but may help her regrow hair.
Right.
So what do you think of
What's
that
the name of it again?
It's called aldactone, ALDACTONE. Now, I happen to have a pet peeve with aldactone in that I don't like the generic, because there's so many generics available, and when you're affecting, it's not a hormone, but it blocks the hormone receptors.
Right. It's actually a diuretic.
It's an off-label use. It's not FDA approved for this, so we're talking about our opinion of a medication and an observation, not an FDA approved use of it. But it's an off-label use. So once a medication is FDA approved for one thing, you can legally use it and recommend it for anything you want to recommend it for. But there's a reason why it works for this. So one of the side effects, which is the main effect for us, is that it blocks hormone receptors, and that should make a nice difference for her. Does she have hair growing on her face or her chin? Does she have other issues or weight issues?
No, she doesn't. She's
all right. That's good. That's very good.
No hair growing on her face, and she's a normal weight.
Good.
Sometimes that can be associated with the high testosterone.
And her periods are regular before she was on the pill?
Well, actually, I talked her into going off the pill about 4 months ago, and she hasn't had a period yet.
Uh-huh. Yeah. So So she might have a polycystic ovary syndrome issue going on also. There might be other hormonal things. And so being on the pill, the aldactone may be helpful for both that and for the hair. Dr. Halem, would you recommend something like Rogaine for her as well? What other treatments would you do?
I would recommend Rogaine. First, I would have her see an endocrinologist also, baseline.
And now would be a good time because she's not on anything.
Right. And just to see what's going on and why her testosterone's high and what else can be done. But I would also recommend Rogaine. I like Rogaine.
Me
I
too.
think Rogaine's great. I would start with the Women's Strength, the 2%, and it's minoxidil. It's right over the counter.
And the generic of that is fine. It's
The
2.5% female strength is fine. Is it 2 or 2.5?
I think 2.
2?
Either one.
Yeah. It's low. It's half of the men's strength.
You just want to be careful that you don't get it anywhere else. And I haven't seen this really with the 2%. But if you do, get it, theoretically, if you get it somewhere else, you can grow hair in the other places. So you want to you want to make sure you don't get it on your face or anywhere like that.
Okay.
So Rogaine for women is a thought. I would definitely see an endocrinologist, and sometimes I find that dermatologists are much more open to the idea of aldactone than endocrinologists and GYN. I don't know why they don't like them, but in our hands, we find that it helps the acne quite dramatically, helps hair loss. For acne, I use a very low dose, like 25 to 50 milligrams. For hair loss, I find that I have to go higher in the dose. So if she's a very active girl who doesn't have high blood pressure, then it's not a direct blood pressure medicine. It's a diuretic. It's a water pill. So by losing volume, that indirectly helps lower pressure. And it's not even a great diuretic. But so you just want to make sure she drinks enough water and every now and then gets a potassium level checked. But you need higher doses to help with the hair loss. But it can be, and it takes a little while. The effects are not overnight. It can take 3 to 6 months to a year and sometimes longer to see the benefits. So it's something you would have to stay on and see how it does. And what I was talking about this with Dr. Strober in the first hour. He likes this medicine too. And we find that the side effects are pretty low with it. So it's a very well tolerated drug. It's not a hormone. It's a pretty easy drug to take overall, but you just don't want to get pregnant while taking it. So that is helpful to be on the pill. So that that helps lower the risk of pregnancy, because you don't want to block.
The aldactone helps with the skin and the hair regrowth.
Yes, yeah, because that's the same hormonal issue.
But she can go on birth control pills along with that.
Right, that's a good idea. Right.
Yeah. Okay.
All right, Mom.
Yes.
Thanks, Jay.
Thank
Thanks
you
for your
very
call.
much. All right. Bye.
Bye. We have Wanda in Alberta, Canada. Hi, Wanda. Are you there? I think we might have lost Wanda. So let's go to Sarah in California. Probably warmer in California than Alberta, Canada. I have a thing with the weather. Everywhere I look at on our little map, I think of the weather. Hi, Sarah.
Hello. Thank you for taking my call. It is beautiful out here.
Oh, all right. Well, don't rub it in.
Sorry.
We have a storm
75.
coming. 75.
Well, I had a question about anaphylactic reaction that I had earlier this week, and then listening to the conversation about the hair loss. Now I have another question.
Okay, good.
So
we're happy to be able to answer.
Okay, good. So, the interesting part is this whole week my hands were a little swollen, and then all of a sudden, I swelled up by the end of the week. I had a rash. I had hives. I had to go to the ER, and they treated me for an anaphylactic reaction with prednisone and Benadryl and all that stuff. Now, my question to you for the first part is, do I really have to be on prednisone for a period of 10 days? Can I just not be on it?
Okay, first of all, an anaphylactic reaction really implies that you have difficulty breathing and swallowing. Did you get to that level, or you just had the hives?
I had the hives.
Yeah.
I had the rash, and then my chest was hurting, but not to the point where I couldn't breathe or swallow.
Okay. So, the thing is, the underlying cause is often unclear for hives, and it can be from a viral infection. It could be from something you ate or some exposure, but typically we don't even look for the underlying cause when it's a first-time hive issue, and if it doesn't last as long as 6 weeks. But it can last as long, typically 6 weeks is like a standard kind of a measurement that we've used. And so not the prednisone, the steroids for 10 days are probably a good idea. I mean, I don't know. Are you all better now?
Well, it's the third day already, but my hands are still swollen a little bit.
Right. So that's kind of telling you.
Itchiness.
Yeah. So that's kind of telling you that you do still need it. And then my concern is more that you need even longer than that, because at the 10 days, what we found is sometimes you stop the steroids, you're done with them, you've tapered off, and then as soon as you stop, it all comes back. So this may not end in 1 or 2 weeks. It may last up to 4 to 6 weeks. And that's why we were talking about the antihistamines. What would you recommend, Dr. Halem?
Well, I would definitely recommend antihistamines, and sometimes you have to combine it both.
Yeah.
There's several different types of antihistamines, and we often use a combination of them. But the prednisone is a good idea, especially since you were having some chest pain. Now, you didn't have any trouble breathing. Did your lips get swollen or your tongue get swollen?
Yeah, my lips were extremely swollen, my upper lip.
Yeah, so the prednisone, what that does is it just calms down the inflammation. And you do want to stay on it for a while, like Dr. J was saying, that it often comes back if you stop it too short. So you want to make sure that you follow what the doctor recommends and continue on with the prednisone. Can you relate it to anything that had happened, or did you eat anything that you can remember?
I didn't eat anything out of the ordinary. That's why I'm having a hard time trying to figure out what happened, because I've had 12 years ago I had a similar reaction back in college, but again I was working with plant hormones. I didn't do anything that day. That I just came up with hives and ended up in the ER again.
Yeah, and like Dr. Day said, we often don't find out what what causes it. But it is important that you continue to follow it. And for very advanced cases, we'll often give patients what we call a epinephrine pen that they actually carry around with them.
Yeah, they do.
Okay, yeah, and
they did give me that.
Great. That's just for your protection in case, this does happen again and you need that emergency rescue.
Okay.
Okay, and I do think that this can go on a little bit longer, so definitely follow up with your doctor if you find that once you stop the medicines, you start to have the symptoms back. Because you might need to take more prednisone or to just get on a higher dose of antihistamines. And you may even want to start the antihistamines now if you haven't already. Okay?
He did put me on Zyrtec along with Pepcid or Zantac, the combination.
Okay, that's good.
Apparently those two combinations work better together.
Good. Right. And hopefully you'll get some rest. I hear some little ones in the background there.
Yes, I apologize for that.
No, that's fine. It just sounds like you have your hands full, and that stress doesn't help too much either. So tell them that on Dr. Radio, we said that they have to behave and listen to their mom.
I was trying to let them know. Thank you so much for taking the call, though.
No, they sound adorable. Thanks for calling.
Thank you.
We're at 1-877-NYU-DOCS. That's 1-877-698-3627. Happy to take your call about hair loss, focusing on women and hair restoration issues. But if you have other questions you'd like to ask us, we are here. We'll go to Barbara in Atlanta. Hi, Barbara.
Hi, how are you?
Good, thanks. Thanks for your call.
Yes, I was wondering, I've had hair loss for quite a while. I'm 58 now, and I take 10 milligrams of Lexapro that my doctor had given me. I have fibromyalgia, and also a diuretic I take. And I wondered if either of those two drugs can cause even more hair loss.
What's the diuretic? Which diuretic?
It's hydrochlorothiazide.
Okay.
Yeah, so actually both of those can actually lead to some hair loss.
Really?
Yeah, both of those. But, you have to weigh the risk and the benefit because the Lexapro you need and the hydrochlorothiazide, they can try to switch you onto another blood pressure medication. But, a lot of the blood pressure medications do cause a little bit of hair loss. Have they looked into any other reasons why you've been losing hair?
Well, it's interesting. I was listening to your show, and that's why I decided to call in because recently my father passed away, and I noticed probably 2 or 3 months after that, it was a stressful time. He died pretty quickly, but I noticed after that I had an unbelievable amount of hair loss, and I was attributing it to my hair color. But now I'm thinking, counting back the months, I'm thinking, well, maybe it was more stress-related.
Right, and it's often a combination. So, the medication plus on top of that, you going through such a stressful period can definitely, exacerbate the hair loss.
Sometimes when I take the diuretic, if I'm not careful, I get thirsty, really thirsty a lot.
Yeah,
and I wondered if just being dehydrated can also cause hair loss.
Well, not that I really know about. I can't see
so
there's
it's
any.
more the medication.
Yeah, it's more the medication. There hasn't been any studies looking at dehydration and hair loss, so that I haven't heard.
Yeah, Barbara, I would say even with the medication, I would be really careful because, when we talk about medicines and hair loss, we're talking about what we see in the package insert. So if you look at the package insert for these medications, you'll see that one of the possibilities of side effects is hair loss. And a lot of times we don't know how all these medicines work. And so, somebody who's taking the medicine says, oh, I have hair loss. And so enough people say that, they put it in the package insert. But we can't say that, oh, you take this medicine and boom, you're going to have hair loss. It's just, it may be that people who have some depression also have stressors and other issues that also contribute to hair loss. So it could be a lot of different things. So I definitely wouldn't say that if you go off your antidepressant, the hair loss is going to get better necessarily. And so that wouldn't be... I wouldn't look for that as an excuse to kind of go off it or a reason to think that it's hurting you, especially if it's helping you on the other side.
Yeah,
now,
definitely.
The thing about the diuretic is kind of good news in the sense that if you need a diuretic, we were just talking about a different one called aldactone. And aldactone is a great diuretic. Well, not a great diuretic. It's actually not a great diuretic, so maybe you won't be so thirsty. But it's a diuretic that's used for people with high blood pressure, and it helps with the hair loss.
Well, you know what? I don't have high blood pressure. I have it. I take it because of Meniere's disease.
Oh, well, ask them if they want you to be on a. That's fine. If they want you to be on a diuretic, ask them if aldactone would be okay to take.
I will do that.
Yeah,
I'll
and then this
definitely
way you'll
do that.
solve
Solve
two
both
problems.
I also was told to use men's Rogaine. I only use the women's, and I really only use it once a day.
That's fine.
I guess I should use it. It is?
Yeah, I only
a day?
recommend it once a day. It says twice a day, but I think it works
usually-
just as well once.
I
yeah.
agree. I recommend it once a day, and
Yeah.
you can go up to the men's strength, the 5% strength.
Well, it really makes your hair sticky, so I'm going to try to stay away
It
from that.
is.
But
Yeah. Well,
okay, thank you so much. Oh, I know. I had one more question, and that was about exercise. I just sort of believe in my heart of hearts that good circulation and exercise is probably good for hair growth. Is that
I
true?
agree.
I agree too.
Absolutely, and it's good for everything. So
Yeah.
So and I think it's good for everything. I don't think there's a study that shows it's good for hair in particular, but it's good for everything, and that's good for your hair. So
Well, that's
yeah,
good.
so
So
definitely,
keep it up.
yeah, keep that up. That's awesome.
Okay. All right,
Great.
well, thank you so much.
Great.
I appreciate it.
Thanks for your call.
Bye-bye.
I think we have Wanda from Alberta, Canada back. Hi, Wanda.
Hello, how are you?
Good. We tried to get you before. I think we lost you.
Yes, I'm in a very desolate area.
Oh.
I apologize.
Well, I have a feeling that it's probably colder in Alberta, Canada than it is in New York, so I was really excited to take your call. And after we went to California, and she was telling us, yeah, it's 75 degrees. I was like, where's Wanda? We need Alberta.
Oh, my. Well, see, and I could only say it's like probably minus 20-something Celsius, so I don't know what that is Fahrenheit. And we have
It's
lots
cold.
of snow,
It's
and
cold.
it's great.
we
know?
get that it's cold. So,
It's not that cold. It's not that bad.
you have a good attitude. I would, yeah. All right.
It kills the germs. Let's put it that way.
So what's your question for us?
My question is, I have an underactive thyroid, and I was on Synthroid 75 for meds, and my hair is quite thin, and I was finding that with the Synthroid I was losing even more hair,
Right.
and so I was wondering, now natural medicines, like the natural prescriptions or pills, would that help me to bring my hair back? Like it's getting to the point where I just want to put a wig on.
Okay.
What natural medicine are you referring to?
Well, I was looking at ThyroSense from GNC stores and taking kelp.
Yeah, I can't say that there's been any real studies looking at those natural medications and what they would do for hair restoration. So it's hard for me to recommend that without having some science behind it.
And I definitely wouldn't do that to replace your thyroid hormone. If those ones can supplement, I mean, I would probably, you have a few choices. You can try those along with your thyroid medication and see if you then start to need less thyroid medication and start lowering your dose if your thyroid starts to pick up. That's one.
Mm-hmm.
Two is, I happen to like Levoxyl better than Synthroid. So just switching the thyroid hormone that you're taking to a different brand is sometimes helpful. Now, I'm saying that based, again, on my own opinion, not on a medical study. But that's just been my observation, seeing a lot of hair loss and a lot of thyroid issues as well. And again, I said before, and I think Dr. Halem agrees.
I agree with you on the
that that having an underactive thyroid doesn't make your hair fall out in particular. It makes your hair drier and more likely to break. But the hair loss is a separate issue. Now, Hashimoto's, or this underactive thyroid, the most common cause is Hashimoto's, which is an autoimmune thyroid condition where your body's immune system attacks the thyroid. And so if you have one autoimmune condition, you can have others. And so there's an autoimmune type of hair loss called alopecia areata that we usually see. We're talking about common causes of hair loss. We never even got to this because we started with calls. But alopecia areata, you see round, discrete patches of hair loss. It could be anywhere on the body, but of course it's most troublesome when it's on the scalp, but it could be on the brows, the lashes, anywhere else. But sometimes it's not a discrete patch. It could be just a diffuse type of a thinning, and sometimes a biopsy can help diagnose that, and cortisone injections into the scalp can help the hair regrow if that's the case. So it might be worth seeing a dermatologist, seeing what else is going on in the scalp, what it looks like, and sort of seeing your options. But if it's a female pattern hair loss where, as Dr. Halem was describing, you keep the frontal part of the hair, and then you kind of lose in the crown region of the scalp, then that's really more of a female pattern. And then you would want to know if your periods are regular, if you have acne or weight issues or any signs of polycystic ovary syndrome. I have found that even when all the hormone levels are normal, you can still have a hormonal, I call it a hormonal hypersensitivity, because I don't think we know how to measure hormones. They're such, they're in micrograms. When you talk about 75 of Synthroid, you're talking about 75 micrograms, not milligrams. That's a teensy amount. That has a very big effect. So I think we're not measuring the right hormones or the right metabolites. We just don't scientifically understand them yet. And it's also a local hormonal phenomenon. It's not always necessarily systemic. So it could be the androgenetic pattern that Dr. Halem was saying was the most common type of hair loss. It could be alopecia areata in a more diffuse way. And there are treatments that you can try for it depending on what it is. So it's worth seeing someone. And then you can try Levoxyl instead of Synthroid, see if that helps. Add the supplements in. Ask your doctor if they know about it to see if it doesn't contraindicate in their view. And then if it's helping your thyroid, then you'll see your TSH will start to come down, and then you can lower your thyroid medicines. But I wouldn't just stop the thyroid medicine and try the supplements that are homeopathic.
Okay. Yeah, because it's so thin, like on the sides of my hair, like above my ears and everything. Like you can see my scalp, and it's just really debilitating for your confidence.
Yeah, I totally get it.
Yeah. I joke around. I'm going to get breast implants so that people look at my boobs and not my hair. Well, but I won't go that far.
Yeah, that's funny. Well, that is a good point, and that a makeup artist did tell me that if you want to distract from a problem area, make another area pop. But I don't think they were thinking breast implants. I think they were thinking like red lipstick. So keep it in perspective. And you have your sense of humor, which is great.
I have. Well, I just figure my saying has always been, if you're gonna have hair like this, you have to have a sense of humor.
Good.
So that's
but see a dermatologist. Yeah, that's so good. And see a dermatologist. Maybe they can help direct you. And there is potential. If there's no scarring, just know there's potential for the hair to regrow. So you want to maximize that potential.
Well, because I've looked into like hair transplants, and they have those ones where they have the injections. It's not where they cut a line anymore. And so in the injections, and maybe that injections is what you're talking about with the dermatologist then?
I think that's a little bit different. They're not really injections. What they're doing is, in the past, what we used to do with hair transplant is we used to cut a long strip from the back and then use those follicles to be transplanted. Now what they're doing is called follicular plugging or follicular grafts, where they're actually doing a very small biopsy and using that to take out the hair follicles. The injections that we were talking about before was mostly for alopecia areata, and that you can actually do injections of steroids, and that could help. But I agree. I would probably go to your dermatologist, have them work you up, see what else is going on, have them look at the pattern of hair loss that you have, and see, you may need a combination of some treatments.
Okay. I will look into that, and if nothing else works, then I'm going to, start going into wigs and treat it like shoes. You can never have too many and not enough colors.
And you know what the great thing is with a wig? That when you need to get your hair done, you just send your hair out.
That's great. There we go.
That's a good side.
And you can be blonde one day and brunette the next.
Long hair one day, short the next.
Yeah. Well, I figure if it comes to that, I'm going to have fun with it. So
good.
There we
and
go.
I would say that's a great idea, and it's a good attitude. And also, when you start, if you do start to go with like some fun with hair pieces and things, it's not always a whole wig. There's clips and there's different things you can add. But the one problem I see is that people go for too much volume and density, and so they end up having pieces that are too heavy. And there are times when it's not natural to have so much hair either. So whatever you do, try to go slow and just do a little bit at a time to complement and accessorize and have fun with it. But don't get used to it getting like big, heavy. It's like more after a while. Okay?
Yeah. And I can't go for the extensions or anything because my hair's too fine for it.
Right.
So it would just break it off. So I figure we'll just go for the full wig or nothing. So
okay, then.
It'll be good.
Good.
I'll work it out. Okay, well, thank you very much for your advice.
Thanks for your call. We're going to take a break, and when we come back, we'll take more of your calls with Dr. Halem. Stay tuned. We'll be right back.
This is Dr. Radio, Sirius 114, XM 119, and on the Sirius XM app for smartphones.
Welcome back to Dr. Radio. I'm your host, Dr. Doris Day, and this is the Dermatology Show here on Sirius and XM, Sirius 114 and XM 119. I am clinical assistant professor at the NYU Langone Medical Center, and for this hour, I am very lucky to have as my guest Dr. Monica Halem. I want to make sure I pronounce her name correctly.
Perfect.
Who is a dermatologic surgeon practicing in New York City at Columbia Doctors East Side, and she is associated with New York Presbyterian Hospital as well. So welcome to the second half hour.
Thanks for
We'll
having
give
me.
out our number and jump right back into calls. You up
Perfect.
for that?
Yep.
Okay. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. Let's start with Mary in Texas. Hi, Mary.
Hi. Actually, my question was for the hair loss. Is that second?
Yeah, no, we're still talking about it. You're with us. You're right on topic.
Okay. Well, after chemotherapy, I had ovarian cancer, and I was 39, and my hair never really grew back as well.
Mm-hmm.
And I didn't know if it ever would. I don't think so. But I just started on estrogen therapy, the hormone replacement. I didn't know if that would help or if it would make it worse.
It would probably help a little bit. As women get older, we lose our estrogen, and hormone replacement therapy does allow that to come back. And I've seen a lot of patients that have gone on HRT or hormone replacement therapy restart to grow hair. So I think it personally would help. How long ago was your chemotherapy?
4 years ago now.
Okay.
But I went into like instant menopause. It was horrible.
Yeah, chemotherapy can do that. But I certainly think the estrogen would help.
It has testosterone in it too, though. A low dose of that, is that going to?
Well, testosterone can, cause you to not grow hair, but if it's a low dose, I would see how it goes.
And it can take 3 to 6 months to really see any difference.
Okay, I just started on it, so.
And how are you feeling with taking it? Any side effects?
No, It's
Okay.
Less hot flashes, which is good.
So I would say as long as your doctor feels that it's safe for you to be on the medication and you don't have any side effects from it, I would give it 3 to 6 months to judge. And then ask your doctor if it's okay to add in Rogaine. You can add in, start with the women's strength, and then add the men's strength. I am a fan of doing everything at once. Like, I'm not a purist when it comes to this. We want the hair to grow, and if it takes a combination of things to give you the best results, then do everything. So if they say it's okay to use Rogaine, I would add in Rogaine as well.
I agree with that. You want to attack it at every different level that you can.
Yep, and I even have a device in my office that's a hair growth laser, and it's an FDA-approved wavelength of light for helping to regrow hair, and it improves the circulation. And I do that along with Rogaine and other medications as appropriate, Propecia for men, Aldactone, or other medicines for women, and another homeopathic supplement called Viviscal. And I find that combination can often really help accelerate the hair regrowth process and certainly help stop the hair from falling out further. So, you can start with see if the medicine helps, ask if Rogaine's okay to use, add that in, look into Viviscal. You can get it from your doctor, or I think that there's some versions that are a little bit lighter dosage you can get online or from a salon even, and see if those help you.
Now I have like a kind of a bald spot after too. Is that those just dead? Never come back?
It may come back. We don't see scarring.
Yeah, but see, that's what I was thinking of as well, like when the hair doesn't come back. Sometimes I've seen alopecia areata, which is the autoimmune condition, be triggered by the chemotherapy. So that you might see if your dermatologist and if your doctor says it's okay to have the cortisone injections at that bald spot in particular, that might help the hair regrow. We'll show a dermatologist, see if they agree if that's alopecia areata, and you would still do those other things, but it may be that you have two different things going on. One is from the going through the cancer and the hormonal changes sort of being pushed into an androgenetic pattern of hair loss. That's the typical female pattern. And the other is having a secondary autoimmune condition that can sometimes also happen after chemotherapy. So that you might be able to really fix that part easier than the overall hair loss from the female pattern. Okay?
And is it true that wearing baseball caps is bad can make you go bald?
It's not, it's not the wearing of the hats or baseball hats or anything like that, but there is something called traction alopecia, and that's when you wear your hair pulled back, very tight ponytail or bun for a long time, and that can actually damage the hair follicle, and you often see the entire front line of someone's hair where there's missing hair. So, you don't want to keep your hair in a ponytail or a bun for a long time because there is that entity.
Gosh. Okay, I do that all the time at work. So
if you do, just make it loose. Make sure it's not too tight.
Okay.
Okay.
Good.
All right, Mary.
Alrighty.
Thanks for your call. Be well. Feel well. I had an interesting patient a few weeks ago who had gone through breast cancer, and after the chemo, she went through chemo and radiation and surgery, and she was doing really well. But then she had complete loss of all hair on her entire body. So her hair had grown back and everything, but she ended up having alopecia universalis. So sometimes I find that for whatever reason, it can be chemo, it could be whatever stress of going through that whole thing, you can be pushed into an autoimmune, or it can't necessarily cause, but I think it can trigger.
Maybe exacerbate it,
Yeah, and make worse an autoimmune condition. So she's actually sitting under the hair laser and doing these other things, and we're starting to feel some stubble. So we're pretty encouraged. Yeah, and actually, it's funny because I saw her, and her hair looked just completely different, and because she really had these very beautiful tight curls, like long hair and tight curls. And then she came in one day with this beautiful straight hair. I couldn't tell it wasn't her. I didn't know because she hadn't said anything yet. She was coming to tell me, and I just looked at her and I said, "Wow, your hair looks so beautiful." It was a wig. You couldn't tell. It looked so amazingly good on her. And I think sometimes if you have no hair at all, it's almost easier to wear a wig and to make it look. There's really such great work. So she had a place that she found that had reasonable wigs that looked amazing. And she said it was really comfortable. But of course, it's nice to have choices and to have your own hair if you want. But
I've seen some beautiful wigs. So.
And so, that alopecia areata, alopecia universalis, if you're post-chemo or post-medication, I think that is something to consider. And, the cortisone injections can help, not so much for the universalis, but for the other ones. So we ready for another call?
Yep.
All right, we'll go to Texas. We have Marianne. Hi, Marianne.
Hi, how are you?
Hi.
Great, thanks for your call. How can we help you?
Well, I had a thyroidectomy about 2 years ago, 2.5, 3, whatever. I was losing hair before because I had nodule on the right side and I had like 4 or 5 on the other. Lucky for me, it was nothing.
Oh, good.
That's great.
But they had to remove everything, paras too. And
the parathyroid too? Uh-huh.
Right. So I'm on levothyroxine, 100 milligrams. But I saw on the internet where this doctor, I don't remember his name, says that you should take iodine with it. I mean, I lose hair. I don't lose patches like everybody else that I've heard here of late, but I just lose hair every day. Mm-hmm. And I don't know. I figured whenever I had the thyroidectomy that after about a year or so that would virtually go down to a minimum. I think it's reduced from what it was, but it's still freaking me out.
Okay, so the iodine isn't going to affect the hair growth.
Right.
The iodine, it may have been referring to thyroid, but you don't have a thyroid anymore, and so for you, you're kind of bound to taking the thyroid medications. So it's two different things. So it may be that going through the surgery may cause that stress shedding, and now that that's past, that any of that hair that's going to grow back will have grown back already. And so it becomes a matter of sort of seeing your doctor to see the pattern of the hair loss, what type of thinning you have, if there's itching, scaling of the scalp, discrete patches. It sounds like your overall thinning. Yeah, so it sounds like you have, I mean, again, having not been able to see you, but sort of from your description, it sounds like the thyroid is completely a separate issue from the hair loss. And it sounds like the hair loss is a genetic pattern that would fall into the category where Rogaine might be helpful, and things like the supplements and the hair laser.
Yeah, well.
Yeah. So, but Rogaine's over the counter, and that can be helpful. And you know what? I've seen people get so creative with hairstyles. Oh, you know what else? There's also a powder. Do you recommend this? There's a powder called Topic.
I don't know about this.
Oh, there's a powder called Topic. It doesn't grow hair, but it's a hair expander. So you kind of like sprinkle it on your scalp, and it comes in different colors. It doesn't color the hair. It's not going to cover your gray, but you just sprinkle it on, and it kind of goes from shampoo to shampoo, and it makes your hair, I mean, it really can be life-changing. And if it rains, nothing happens. It's not going to color your clothing or, kind of out you for your hair loss. And I think Joan Rivers has a similar powder that she sells on QVC. And then there's another one, I forget the name. It's like Millionaire something or other. I can't remember the name of it. Do you know that one?
No.
There's a bunch of them out there that are powders. And what you should do is whichever one you get, you can look online for these because I see you're good at the internet. You can put it in an atomizer where you do a little spray, like a perfume atomizer kind of a spray, and it makes it a finer mist. And so you can have a little bit more control so it doesn't look clumpy. But I tell you, it can be life-changing just immediately in how it looks and give you that confidence to go out.
Okay, well, I don't have I don't look like I'm balding.
Good.
Not yet. And I've been losing hair for like 3 years, actually more than that, because it was 2 years before we ever did the surgery.
Uh-huh.
And again, remember.
And I have real long hair, and I can't wear it in a ponytail because it gives me a headache.
Uh-huh. Good. So you're doing things right. That's good.
But the reason I asked about the iodine was because he said that he gives you there's a test you can take online there, and it says, can't sleep, which I can't. Get angry easily, lose hair, and a bunch of other stuff. Well, there was a lot of things on there that I said yes to, and at the bottom it says 70%, 70 plus. In other words, you're a nightmare. So,
no.
taking the iodine with the levothyroxine, with the fact that I don't even have a thyroid, would that really help those other areas maybe?
I don't know, but what you're describing, I don't know the answer to that, but I can tell you that everything you're describing is so nonspecific that it can go with just about any drug or illness or anything. So
that's what I was thinking.
Yeah, so it's just, there's an expression that if you only have a hammer, then everything you see is a nail. It's like, you could point everything into one thing if that's all you have to do for it. So, iodine's been around for a while. And we used to do it like when we worried about radiation, you do iodine to protect the thyroid against it, but that's not your issue. So my expectation is it's not going to do much for you, but you know what? It's worth asking your internist and seeing if they work with a nutritionist and ask them. And, if they say anything different, then give us a call back because you'll tell us something. But my expectation is it's not the be-all, end-all. It's not going to be your answer. But meanwhile...
I had a hysterectomy 100 years ago, 20, but I don't take hormones. And maybe I should ask my doctor about starting hormones.
Yeah, or other things that you can do to help make you feel better. But I just don't think iodine's going to be the answer from what I know.
I appreciate you.
Great. Thanks for your call. I tell you, we have callers with the best sense of humor this evening. It's been so much fun. And I will give our number one more time. We're at 1-877-NYU-DOCS, 1-877-698-3627. And I'm Dr. Doris Day here with my guest, Dr. Monica Halem, who is a dermatologic surgeon in New York at Columbia Doctors East Side and also affiliated with New York Presbyterian Hospital. We have Veronica in California. Hi, Veronica.
Hi, thank you for taking my call.
Great.
I have a question. I'm just recently, in the last 2 months, I've been losing my hair from the top of the forehead and on the sides where you're able to notice. And when I get out of the shower, when you're like draining your hair from the excessive water, like I see strands of hair just coming out. When I brush my hair, the hair is just falling out a lot. And I also had thyroid cancer diagnosed back in July, and I had the radiation treatment, and I'm still going through the adjustment of the levels and all that. But I'm also having patches of circle, they look like ringworms, but they tell me it's not a ringworm. So I'm just wondering if it's something that I should be checked for, or...
Where are those patches?
I'm sorry?
Where are those patches?
They're only on my arms, my wrist, the inside of my wrist, and the inside part of my arm, and it's only on my arms. That's it.
Okay.
And they look like ringworms, and then when I looked it up on the internet, they look like the red ring is a complete circle, but the inside is normal, and then there's in the inside like a bullseye kind of deal. And I looked it up on the internet, and they said it was something of Lyme disease, which I got tested for, and it came out normal. So I don't know if it's something to be related to the rash that I'm going through, because my hair is also, I'm developing dandruff, where my skin is really dry, and the doctor keeps saying it's because I'm, my body's still getting adjusted to not having the thyroid, and I'm barely getting my levels adjusted.
Okay.
So I don't know if there's something else I could ask the doctor to check me for.
All right, well, you have a lot going on.
Exactly. You have a couple of things going on.
Yeah. For the rash on the arms, I would start with that. And I think there's, you can try tweeting it, common things being common. You can think of, could it be a type of a drug rash, or could it be a form of eczema or ringworm? Now, if you're going to get ringworm, you sort of have to have an exposure to kids, to dogs, to some, to have it from, or even from yoga if you're doing exercise from the gym. Mats. So I would consider that as a possibilities, and one way to know is to do a little biopsy. So one is you can try treating it with doing a scraping to try to culture a fungus and see if that grows. Try a topical cortisone, try a topical anti-yeast, and if it doesn't get better, try a biopsy. To try to get more of an answer. Now for the scalp, it sounds like you are going through that stress shedding that we were talking about. Dr. Halem, what would you say about her scalp?
Right, I agree with you. I mean, you just got out of surgery a couple months ago. You're adjusting your hormone levels. So I think it's probably related to that. Give it at least 6 months after the surgery, 6 to 8 months, and see if that helps. See if it comes back.
My surgery actually was in July, but I didn't start taking my hormones like on a daily basis, because you have to go through your radiation, all that stuff. So as of October, they started off on the lowest dose, and then every 2 months they higher my levels. But every time I go to the doctors, they tell me that the rash has to do with something about, I guess, a side effect that your body's getting adjusted to not having a thyroid. So my thyroid level is too low. But when I saw my dermatologist, he said the same thing, to get the scrape to see if it's any fungus or any Lyme disease, and that all came back negative.
So then they might just do a biopsy.
The itch.
Yeah, so I would consider a biopsy. I mean, it could be something called lichen planus. It could be any number of things. So I would say a biopsy would probably help point in a direction for that. For the scalp, it sounds to me like a lot of that hair should come back over time, that you may also have an autoimmune thyroid scalp condition, the alopecia areata. So if they're round, discrete patches, your dermatologist might offer cortisone injections as well. Once you stabilize all the thyroid and you get to a level where you're comfortable, everything should slowly bounce back. But, when someone comes in and they say, my hair is coming out in every time I touch it, it's coming out in, masses, like just strands everywhere. That to me is a sign that a lot of that hair, if not all of it, is really going to come back over time. Because in a female pattern, it doesn't do exactly that. It's usually more of a slow, insidious kind of thing. In a stress shedding, it just comes out, then it passes and it grows back. So my hope for you is that that's the case, and that you'll call us back and tell us your hair has grown back, your rash is cleared, and you're doing great. So good luck with that. Wait, unfortunately, we have to run. So, but we'll be back next Thursday, and we'll take more of your questions, okay? So definitely give us a call back. So, Dr. Halem, this hour has gone by so quickly. I wanted to get a chance to say thank you for being here.
Thanks for having me.
And do you have a website that people can look for you?
They can actually go right to our, I'm part of Columbia University, so Columbia University Dermatology.
Perfect. And thanks for being here. I'm Dr. Doris Day, and we had such a fun hour. We talked about psoriasis, took as many of your calls as we could, talked about hair loss in women, the most common types being a stress shedding called telogen effluvium, a female pattern hair loss called androgenetic alopecia, and then the autoimmune alopecia areata. It's worth getting evaluated by your dermatologist as well. So I'm Dr. Doris Day saying thank you for listening and calling in, and we'll be back soon.